All right, let's get right into it. We're talking about one of the most profound and frankly challenging concepts in all of medicine, brain death. It's a term we've all probably heard, but it sits at this really complex intersection of biology, law, and ethics. So what are we really talking about when we say someone is brain dead?
And this is the question that gets to the heart of it all. I mean, how can someone be dead if their heart is still beating? It feels like a total paradox, right? You might see a chest rising and falling, you can see that heartbeat on a monitor, but the doctors are saying that the person is gone. To even begin to wrap our heads around this, we have to go back and look at how we even define death itself.
And that's really the key to solving this heartbeat paradox. The definition of death has had to evolve right alongside our medical technology. It's just not as simple as it used to be.
So a lot of this comes down to a legal framework. Back in 1981, a law called the Uniform Determination of Death Act actually established two legally accepted ways to be declared dead. The first one is the one we all know, circulatory death. Your heart and lungs stop for good. But it also created a second path, neurological death, or brain death. And the law is crystal clear. Both paths lead to the exact same legal and clinical endpoint, death.
Okay, so this is probably the most important thing to get straight. Brain death is not a coma. It is not a vegetative state. It's not sort of dead. It is the complete, total, irreversible end of all function in the entire brain. Legally and medically, it is death. The machines are simply doing a mechanical job of pushing oxygen and blood through a body that is no longer alive.
So you have to wonder, how does a person even get to this state? What's the biological process that leads to this complete shutdown of the body's command center? Let's trace the steps to that point of no return.
It all starts with some kind of catastrophic injury. The brain reacts like any other part of the body. It swells. But the brain is trapped inside the skull, which is a solid, bony box. It has nowhere to go. So as it swells, the pressure inside just skyrockets until, and this is the critical part, the pressure inside the skull becomes greater than the blood pressure trying to get in. And when that happens, blood flow to the brain just stops completely. No blood flow means no oxygen, and the brain cells die. This isn't just some damage, it's a permanent, total shutdown of the entire organ.
Now, given how final this diagnosis is, doctors have to be 1000% certain. There is absolutely no room for error. So how do they confirm it? Well, it all comes down to an incredibly rigorous clinical examination, where they are searching for 3 key signs of total neurological silence.
That's it. The entire diagnosis hinges on confirming this critical trio of findings. It's not a best 2 out of 3 situation. All 3 have to be there without a single doubt.
And here's that clinical triad. First, the patient has to be in a deep, unresponsive coma. Second, all of their brainstem reflexes, those really basic, hardwired functions that keep us alive, have to be completely gone. And third, they must have apnea, which is the total inability to take a single breath on their own. So let's look at how doctors actually test for these things.
This is where the examination gets incredibly detailed. Doctors test these core reflexes that are controlled by the brainstem, the most primitive part of our brain. They'll shine a bright light in the eyes. In brain death, the pupils stay fixed and dilated. They'll gently touch the cornea to check for a blink reflex. There isn't one. They check for a gag or a cough. In brain death, all these circuits are silent. The lines of communication are just completely down.
Now, this is a really crucial point because it can be so confusing and heartbreaking for families. A patient might have some muscle twitches or a leg might move, but these are spinal reflexes. Think of the brain as the CEO and the spinal cord as a local office manager. Even if the CEO is gone, the local office can still have some automatic reactions. These movements come from the spinal cord, not the brain, and they have absolutely no bearing on the diagnosis of brain death.
All right, so the doctors have confirmed the coma and the absence of those brainstem reflexes. But there is one final definitive test to confirm that third part of the triad, the complete inability to breathe. But before they do this final test, physicians are incredibly careful. They have to rule out anything else that could possibly mimic brain death. They make sure the patient's temperature is normal, their blood pressure is stable, and, this is really important, that there are no sedative drugs in their system that could be suppressing breathing. Every other possibility has to be eliminated first.
This is the apnea test. They carefully disconnect the patient from the ventilator, and as they watch, carbon dioxide naturally builds up in the blood. In any living person, that CO2 buildup is like a giant screaming alarm bell for the brainstem, telling it to breathe. It's the most powerful signal possible. If there is any function left in that brainstem, it will respond. When no breath is taken, despite that powerful trigger, it's the final, conclusive proof.
The brain can no longer control the most fundamental function of life.
Now, once this whole process is done, and it often has to be confirmed by two separate physicians, the clinical questions are all answered. But that's when the most profound human questions really begin. What happens next is a matter of law, ethics, and intensely personal decisions.
It's so vital to understand this. The declaration of brain death isn't the start of the end. It's the official confirmation that the end has already occurred. The patient is deceased. The ventilator is now just a machine circulating blood and oxygen through a body whose integrated life has already ceased.
At this point, there are two paths forward. One is to withdraw life support, as it no longer serves a medical purpose for a person who has already died. The other path is organ donation. And for many families, this offers a chance to create something profoundly positive from an unimaginable loss, an opportunity for a final, powerful act of generosity that gives the gift of life to others.
And that leaves us with one last thought. The whole concept of brain death was born from technology, from machines that can keep the body going long after the brain has stopped. So as our technology gets even more advanced, you have to wonder, how will we continue to define this ultimate line? It forces us to constantly re-examine one of the biggest questions there is. What does it truly mean to be alive?